commenting on this very issue, and she says this was never really about health care. Take a listen.
Over the past year, everything that was theoretical has now come home to roost, and people are actually having to use this insurance, and they're finding out that they can't afford to do it because the out-of-pocket costs are so high. This is supposed to be about having access, and people in rural areas, people in cities, young people, senior citizens, nobody really is getting access, and that's why the cost of health care dropped. It's not because the bill is so fabulous, it's because people can't afford to use it. This bill was never about health care, it was about control. And as physicians, we're being dominated by this bill. We're not allowed to really take care of our patients anymore.
She's losing patients. Some of her patients are coming in and saying, my insurance won't kick in, my Obamacare won't kick in until I've paid $2,000 to $3,000. And her patients don't have that kind of money, so now they're not going to doctors, they're not getting the care.
And these are the working people this legislation supposedly was designed to help. She makes such a smart point when she says this is not about health care, it never was. It's about control. This is one step on the way to single payer. And I've got to say, I'm not a conspiracy nut, I don't see any other explanation for this. I agree with that.
That is frightening. And open enrollment began this weekend. No word yet on numbers from people jumped online yesterday and went to the website. It appears that the website, though, is working, finally, a year later, that people can get on there smoothly. But as the New York Times reported yesterday, there's a shot of the website. People are seeing their premiums go up by 20% right now. And the administration's answer in response to this is, well, you should still be able to find a comparable plan at the same cost that you're currently paying, but you're just going to have to shop around.
It's happened in my office at the Daily Caller. You know, our employees, mostly young, they don't make very much, and they are shafted. They're in serious trouble because, the cost has gone up so much they can't even afford it. And these are people working 2 jobs.
That's crazy.
It's really outrageous.
You're just going to have to start paying them more.
Yeah, and if you complain about it, then you're some sort of hedge fund manager. No, these are people making low wages, doing their best, and they're getting totally abused by the system.